Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us today.
Of course.
Thank you so much. My name is Dilshad Burman. I'm a writer and reporter with CityNews and CityNews 680. Today, we are doing a slightly different AMA with the doctor. We're going to be focusing on COVID-19 and the flu and navigating flu season as we're going through this pandemic. So we've been collecting your questions over the past few weeks, and we're going to present them to the doctor today. She's never seen them before. It's all off the cuff. And if you haven't had a chance to submit your questions, you can still do so in the live chat in this YouTube broadcast and also through our website chat window. Now, as I said, this is slightly different. This is about COVID-19 and the flu, but of course we will take your other COVID-19 questions as well. The questions that I'm going to present to the doctor right now are sort of an aggregate of what we've been collecting over the past several weeks regarding the flu. And as we're going into flu season, people have a lot of concerns. So we're going to start with those questions, and then we'll move on to our general COVID-19 questions as well. Feel free to jump in at any point in time and send us your live questions, and we'll take them as they come in. For now, we're going to get started. Doctor, are you ready to go?
Yeah, let's go.
Awesome. Let's get started with these flu questions that we've sort of aggregated over the past little while. The first question is, we've seen a lot of comments on social media saying COVID-19 is just another flu. So what is the difference between the flu and COVID-19?
Okay, so COVID-19 is a respiratory virus similar to influenza. The difference between COVID-19 is that we're in a pandemic. And so what that means is this virus is continuing to circulate for over a year now, whereas we know with the flu virus, there's a seasonality. It comes around now, it lasts until the spring, and then it's pretty much gone for the summer. So that's one big difference is right now with COVID-19, we're in the midst of a pandemic. The virus is not letting up, it's not going away, and it is here. Now, in terms of the symptoms, what's the difference? It's really hard to be able to differentiate between COVID-19 and the flu or any other viruses. I mean, there are many other viruses as well that can give you similar symptoms. And that's why testing is really a recommendation here. Because when we test for COVID-19, there is follow-up. If someone is positive, we self-isolate, we do contact tracing, which is something that we don't do for other respiratory infections.
Right, okay. And let's go to the next question. Can you get the flu and COVID-19 at the same time? And would that land you in the hospital?
Yes, you can get infected with both viruses. There's certainly nothing like if you're developing immunity to COVID that will protect you against the flu. There isn't any of that cross protectiveness, which is actually why we recommend that you get both vaccines, because both vaccines will work in different ways in your immune system. And there's no question that if you get doubly infected at the same time, yes, it can certainly be much worse for you. We actually know that even with a virus like the flu and even with COVID, you can get one infection and then you can get what's called a secondary bacterial infection, like a pneumonia. And that, again, that's two infections at the same time, which can actually make you quite sick.
Right, okay. Let's go on to the next question here. I've never taken the flu shot before, and I am fully vaccinated against COVID-19, but still hesitant to take the flu shot because I've heard that many people actually fall ill after taking the flu shot. And I've never had a problem falling sick during flu season. Should I still take the flu shot?
Okay, so the flu vaccine, like the COVID vaccine, doesn't have the virus in it. So you actually cannot get the flu from the flu vaccine. It boosts your body's immune system the same way that the COVID vaccine does as well. So I think that's the first important point. We do know that when you get the flu vaccine, which is now, like this is flu vaccine season at the beginning of November, there are other viruses that are circulating. And so if you get sick the next day or the day after or the day after, you might think it's from the vaccine, but actually it could be one of the other viruses that are circulating. And so I think that's also important to recognize that being sick after the flu vaccine isn't always from the vaccine. Now you could, feel unwell for a few days following the vaccination. That tends to be mild and you recover just like the COVID vaccine within a few days as well.
Okay, and doctor, with the COVID vaccine, we know that it lasts about 3 to 4 days. How long does it last with the flu vaccine? the side effects?
Yes, 1 to 3 days as well. And it is just the one dose.
Okay. And the next question, are we expecting a particularly bad flu season this year, or will it be like last year where we barely heard about any flu cases?
So the one thing about the flu is it's really hard to predict what the season is going to look like. Sometimes we look to our southern countries like Australia to see what happened there. Australia, though, this year was in a lockdown during their flu season. So they didn't have a lot of flu circulating, which was similar to what we had last year. We had a lot of measures in place. We weren't mixing and mingling nearly to the same extent that we are now. And all of those public health measures helped to prevent the spread of flu last year, actually across the country as well.
Right.
Now, we don't have that this year. So we expect the flu will spread. It's already started spreading. So last week when I looked at the numbers, we had about 6 cases in Ontario. Last year, for the whole season in Toronto, we had 6 cases. So
Wow.
we're already, catching up. And so flu is here, and it will spread.
Right. And so it's sort of, you can kind of tell that we've relaxed some measures. We've started seeing each other. We've started moving around a little bit more, and so things are spreading even when it comes to just the flu.
Yeah, and the other piece that's important for the spread of these viruses is travel. And we've seen that non-essential travel can now go ahead. And we know that travel is another common way that viruses like the flu can also spread.
Okay, we'll do one more flu question, and then we've got live questions coming in already. So let's move on to the next flu question. If you do happen to get the flu this year, will it make you more susceptible to catching COVID-19?
So it's not necessarily that if you have the flu now, COVID will come to you. I mean, when you get an infection, your immune system is working hard. And so if you were to get that second infection at the same time, it could be more difficult for your body. But that is certainly why we recommend that you get the COVID vaccine to have that protection from the COVID vaccine. The COVID vaccine works very, very well. Like, we know that to keep you out of hospital, it works 90+% of the time. The flu vaccine is less effective. So if you had to pick between one of the two vaccines, the COVID vaccine has a better effectiveness. But this season, it's important to get both if you haven't had any, because again, we really want to keep you out of hospital. We really want to, we've talked about this, preserve our healthcare capacity.
Right, absolutely. Okay, let's jump into some live questions. They're not flu related, but they are booster related, because lots of questions about boosters here. So from our website, Phil asks, I'm 80 years old and I received my second vaccine late May. Since I'm traveling to Mexico on December 26th, will I be able to get my booster before I travel?
Okay, so the booster announcement will be coming out, I think, soon after this.
Yes.
So we'll have to wait to see what Ontario advises. The National Advisory Committee on Immunization has certainly recommended that if you're 70 years of age and older, to get your third dose 6 months after your second dose. So you could start doing the math there as well.
Right, absolutely. And as the doctor said, the announcement for the booster shots is coming right at 1 o'clock, right after we finish this AMA. It will run on our YouTube, so you can stay tuned here and watch it and watch the announcement coming live. So let's move on. I guess more booster questions. Let's try and take them. One from YouTube. Red Reaver asks, if boosters are approved for everyone, can we mix and match? I got 2 Pfizers, but I might want a half dose Moderna booster. It's supposed to result in better and longer immunity.
Okay, so the National Advisory Committee on Immunization on Friday released their guidance, which did not give a blanket booster recommendation for everyone. So I think that's important to note. In terms of what NACI recommended for booster, which vaccine to get, it said you can get any of the messenger RNA vaccines. It does not matter what you got for your first 2. If you are a senior, 70 and older, you can get the Moderna full dose, which is 100 micrograms. And if you are not a senior and are eligible for a booster, then you can get either the Pfizer or the half dose Moderna.
Okay, great. And then another question from our website from Jordan. I had 2 doses of AstraZeneca and I already downloaded my Ontario Vaccine Passport QR code. If I get a booster shot as recommended, do I have to download a new QR code, or will the booster shot automatically be linked to the previous one? This might be a technical app question, doctor.
Yeah, we'll have to wait to see what's recommended, but I'm pretty confident that if you are eligible for a 3rd dose, that will not be a requirement for the vaccine passport or certification program.
Right.
So it is an extra dose, not and your 2 doses that you have would be sufficient to get you to that restaurant or wherever it is that you want to go.
Right. Okay, perfect. And let's jump back into our flu questions here. Diwali is coming up and we want to get together with family. Is it okay to gather with people who may have taken the COVID shots, but not the flu shots? And what about meeting people who are not vaccinated against either?
Okay, so we do have guidance similar to what we had for Thanksgiving for Diwali, and really, no more than 25 indoors, 100 outdoors. Prefer it to be outdoors, though, if you can manage, that is certainly the safer option. If you are having people who are unvaccinated or you don't know their vaccination status, then we'll definitely recommend that you keep masks on, have enough space to keep a physical distance in those settings.
Right, okay. Okay, and then the next question is it possible that this year's flu virus and the COVID-19 Delta variant can somehow mutate together into a super virus? Are they the same kind of virus to do that?
These are great questions, right? It's kind of the thing that you need to write in a novel, except these are real life questions, aren't they? I'm not aware of having any concerns about COVID virus and flu virus mutating together. When we talk about changes in the flu virus, like mutations in the flu virus, it is very much related to the current virus that's spreading and changes that it makes. There have been changes that have been made when it jumps from either avian, so bird source, or from swine, a pig source, but not necessarily, I haven't heard of anything where a coronavirus and a flu virus connect.
Okay. Okay, and then another question similar to one that we just had. If you're unvaccinated against COVID, will that mean that you will also catch the flu easily?
Not necessarily. So unvaccinated against COVID puts you at high risk for getting COVID. COVID and the flu are spread in similar ways through droplets. So, some of the things that we do to prevent COVID, including wearing a mask, keeping a distance, washing our hands, will help to prevent getting the flu.
Right. Okay. And that's kind of why, Doctor, you mentioned that last year we didn't see such a high incidence of flus, because we had all those protections in place and everybody was washing their hands and wearing their masks and things like that. Exactly. Okay, let's take another live question here. Again, not flu related, but that's okay. Rupert asks, for the general population, when will the boosters begin? And is this going to now turn into a 3-dose series like hepatitis B? And then also, can asthmatics get a booster?
Okay, so the recommendations from the National Advisory Committee on Immunization on Friday did not recommend wholesome booster doses for everyone. It was definitely for select groups, but the data will constantly be assessed to determine, does everyone at one point need a booster dose? So we can wait for those recommendations to come. And sorry, what was the second part of the
second part was, are asthmatics going to be able to get boosters, and somebody with asthma, basically?
Yeah, so again, we'll have to wait to see. Right now, it's really if you, based on your age, or if you work in a long-term care, if you are a healthcare worker, whether you would be recommended to get the dose. Oh, and then the other piece was, is it going to be considered a 3-dose series? So, so there was additional guidance that was provided there. So in immune compromise, they have had a recommendation for getting a 3rd dose, and that was considered actually a 3-dose series, a completion of their primary series. They probably need 3 doses to get similar protection to what you and I get from 2 doses.
Okay.
This booster dose recommendation that came out on Friday is truly that a booster dose recommendation. You got a good immune response after your second dose, and now there's waning, there's a slow decline. And so it's a booster to help get your immune system back up and running to a better place.
Right, okay. And then let's get to this next one. If I get my second COVID shot at the same time as my flu shot this year, will the side effects be that much worse?
It's a good question, and I know that that's often people's concern, especially with that second dose of COVID. How am I going to feel? It's really challenging to predict that. I haven't seen any good, people who thought they were going to get the worst symptoms had none, and, you just don't know. No, there's no question that if you get both vaccines together, that you're going to get a very serious or be very sick afterwards. There's also your immune system is actually strong enough to be able to handle both of those vaccines and to develop a good immune response to both of them. And I think the thing that you have to think about is, well, right now the risk of getting both of those is high. And so you really want the best protection against both of those infections as soon as you can.
Yeah, I think there's a lot of concern about downtime, because a lot of people have returned to work now full time. And so if you need to take a day or 2 days off after the flu, you need to plan for, after the shot, you need to plan for that accordingly, right? Okay. This is a two-part question. So we've been told to stay 6 feet apart for COVID safety. Is that the same distance for the flu? Does it travel the same amount?
Yeah, good question. I mean, again, the flu is spread through droplets, and in general, droplets don't go further than 6 feet. And so that's why that 6 feet is probably pretty good for the flu as well, too.
Okay. And then the part two is, can the flu virus live on surfaces like COVID-19?
It actually probably does a better job of living on surfaces than COVID-19, actually. So that's all the more reason to be able to clean and disinfect. The flu virus, and actually other viruses as well too, can last on surfaces, I think, even longer than COVID. So I think that's all the more reason to make sure that we're cleaning our surfaces and really washing our hands, not touching our face with our hands, to prevent that. Yeah.
Right. Okay. And actually, we have a follow-up from Jordan, who just asked a question on our website. Let's take that one. Thanks for answering my previous question. Quick follow-up. If booster shots are not reflected in the vaccine passport, what would be the point of getting the booster shot if there's no requirement to get it when recommended? How safe is it to go to restaurants and gyms and other public places when others may not have got their booster shot? And won't they be more likely to get COVID-19 and give it to others?
Okay, good question. So actually, the real rationale right now for those who are recommended to get booster shots is for your individual protection. So what we're seeing is the vaccine is working very well. It continues to work very well. But you'll notice that there have been more elderly people, for example, who were fully vaccinated and got COVID, ended up in hospital. Some even unfortunately died. And so to give them the best protection, because if they get COVID, they can get quite sick. That's one of the reasons to get vaccinated. You'll see healthcare workers were also provided a recommendation, and that is actually to help protect them so that they can continue to work and keep our healthcare system running as well.
Right. Okay. And so when it comes to reflecting in the vaccine passport, doctor, and I know that you're not involved with the app and things like that, but my assumption would be, and I'm not an expert, but my assumption would be, if it were to be recommended, if the booster was to be recommended to everybody at large, then possibly they would have something reflecting your passport as well, correct?
Yes, so good point. I think that first of all, for it to kind of make it to a passport, you have to actually have the vaccine available for a long enough time to give people a chance to get vaccinated before you make it a requirement. Yeah. And yeah, as you said, not everyone is going to be eligible for a booster dose just yet.
Right. Okay. Okay.
And I think it's also important to know that even in those that are recommended to get a booster dose, those first 2 doses are providing the bulk of the protection. And so actually, the best thing that we can still do is get people who are unvaccinated to get their vaccine.
Right. Absolutely. And then we talked about this, but let's talk about it again. How can you tell the difference between COVID and flu symptoms?
By a test. Actually, By the symptoms alone, you really cannot. I mean, there's one symptom. With COVID, you get loss of taste or smell, and you don't get that with the flu.
Right.
So that can be one symptom that can help to differentiate that. But beyond that, it's really challenging, and it's really that test that you need.
Right. And doctor, just to clarify, because I've heard this a lot about the loss of taste and smell. When you have a stuffy nose, you can't taste anything for the most part. Is it different from that? Is it just a complete lack of taste and smell? Because thankfully I haven't experienced that.
Yes, from what I understand, it is different from just a stuffy nose because, and sometimes it can be associated with a metallic taste or that the food is tasting different. Yes. As well. So it is different from just a stuffy nose. Yes.
Okay. And then just to address Rupert's question, he's followed up on YouTube. We just answered this question about how do you know the difference between the flu and COVID based on the symptoms? They overlap. So you mentioned that we need to get tested, correct?
That's right. Yes. Yes.
Okay. Okay, sorry, let's go to another question from YouTube. The CDC criteria allows people with underlying conditions like asthma and diabetes to get the booster shot at 6 months after their completed 2 series. Why is Canada not doing the same?
Okay, so a good question. So that recommendation has not come yet from the National Advisory Committee on Immunization. We have to recognize that the situation in Canada is still different from the US. And even from Israel, because in the US, they gave the vaccines in that short interval. And what we know is that better protection occurs when you have bigger spacing between the first and second dose. And so, most Canadians had that longer interval, whereas they didn't have that. That was not a recommendation in the US, for example. And the time since your last dose. And we know that many Canadians, many Ontarians got their second dose June, July, around that area. And so it hasn't yet been 6 months since most people have had their second dose.
Right, exactly. I got mine in June, I believe. So it's not been 6 months yet at all. And then let's jump back into our list here. Wings submitted a question about the COVID-19 and flu. Did the Moderna COVID-19/flu integrated shot get approved yet?
Okay, so I have certainly heard about a vaccine in the pipeline, COVID and flu. No, it has not been approved for this flu season. It is certainly something to consider. I mean, we don't know what next year is going to bring. We don't even know what January is going to bring, let alone next fall. But if we will need a COVID booster with a flu vaccine, that may be an option, and to get a 2-in-1 vaccine if that trial goes well, if it shows that it's safe and it shows that it works and that it's available and licensed.
Right. And that would be my vaccine of choice, 1 shot instead of 2. I will pick that every time. Okay, so we have a few more minutes left and we're done with our flu questions for now. Let's move into some of our generic COVID questions. So Kathy asks, I am 58 years old, postmenopausal for 7 years, and I received the Pfizer vaccine and started to menstruate. Then I received the second Pfizer vaccine, started to menstruate again. My OBGYN said that she has seen this in other patients. So are women who are postmenopausal finding that they're experiencing periods following the vaccine?
Okay, so this is a really good question. Certainly something that is keeping a close eye on. And, I don't have a definitive answer for you. I'm glad you went back to see your doctor, because certainly if you're postmenopausal and you start bleeding, you want to make sure that you rule out other things that could be causing that. There is not, menstrual irregularities can be common. I mean, we know that there's a number of things that can contribute to that. Stress, having had an infection, changes in life. Like, there are a number of things that can contribute to menstrual irregularities. It's certainly something that's being looked at, being closely followed to see if there's a link. I think what is very clear, though, is that in the long term, there are no long-term effects from the vaccine and changes to fertility, menstrual cycle, puberty, that kind of thing.
Okay, that's really important to know, because as Kathy says, 7 years postmenopausal, that's a very strange effect to suddenly get your period after the vaccine, for sure. So doctor, I remember we talked about, I think, studies in the UK. Does the UK have a sort of, not a warning, but sort of like a heads up about this kind of thing, that you might experience menstrual irregularity post-vaccine?
They have reviewed the data. They continue to assess the data and have said that there's no link, and that's based on thousands of reports. Mm-hmm. So we will continue to look to their data and others to comment on this for sure.
Sure. Okay. And then let's move on. Neer and Sanjana have the same question. What do you think about the monoclonal antibodies for COVID positive patients, and where can we get this infusion?
So you certainly can't get it just because you want it. I mean, there's certain criteria for getting it, including being quite sick with COVID, which I don't think is something that you want. Yeah.
Okay. Okay, let's see. We've got another live question coming in. Another one from Rupert. Okay, Rupert, we'll take this one too. Dr. Dubey, my 90-year-old grandmother will get the booster at 6 months, which is soon. Her caregiver is over 65. Now, can the caregiver to an elderly person also get a booster?
Okay, so we'll have to see what is recommended by Ontario in terms of who is eligible for the booster vaccines. The National Advisory Committee on Immunization said 70 plus, but we'll have to see what Ontario recommends and allows for eligibility.
Okay, and then let's move on to Priyanka's question. Priyanka asks, if parents are vaccinated, what are the chances of getting a 3-year-old infected with COVID?
Okay, so for the most part, more than 50% of kids are getting COVID either from their household, so someone at home, or having close contact with someone who they know who has COVID. Right. So, and then there are, community spread is another way that children are getting COVID. So it's not just from parents that a 3-year-old can get COVID. And so getting parents vaccinated will dramatically lower the risk for that child in that household, but you still have to look at the other ways in which the child interacts, is in other places to determine their overall risk.
Right, got it. Okay, and actually there's another question from Wings. Health Canada announced that people who are fully vaccinated with AstraZeneca, 2 shots of AstraZeneca, I don't think Health Canada announced it though, I think it was a NACI recommendation. They're eligible for a COVID-19 booster shot. So should that 3rd shot be an AstraZeneca one or a mRNA vaccine?
No, they recommended a messenger RNA vaccine. So if you had even 1 dose of a viral vector vaccine, so either AstraZeneca or the Johnson & Johnson vaccine, getting 1 dose of a messenger RNA vaccine gives you the level of protection of a full series of messenger RNA vaccine, okay. Which is really quite fantastic. So if you had 2 doses of AstraZeneca, then the recommendation is that you get a 3rd dose of either Pfizer or Moderna.
Okay. And then a couple more questions coming in from YouTube. Let's take these. Charles asks, when will the mask mandate be over? I got the 2 shots and I don't mind getting a booster shot.
Yes, I mean, we're certainly, waiting for the right time to remove masks, really. I think that's what I would say. I mean, it is right now a provincial mask mandate, so that's the other piece to note. But I think we're seeing in other countries where, like in some countries in Europe, where they've removed things like mask mandates only to have to introduce them again. Right. And so, it is a cautious approach that Ontario is taking, which I think we will all appreciate in the long run, so that we don't have this up and down of, on and off and really trying to then play catch up to prevent the spread.
Right. Let's take another question from YouTube. Bamboo asks, the COVID-19 vaccine was not made a mandatory immunization for schools. It is, however, mandatory for most universities, because I think universities have put out their own rules on that. So will this be lifted along with the other measures that are projected in March?
Okay, so the measures in workplaces, in universities are separate from the vaccine certification or vaccine passport system. So I just want to be able to, because I know that is a very, very common question. So does that mean in January you won't need to be vaccinated to attend university? No, that was not announced. So, and even in January, it still is not announced that to go to a restaurant you won't need it. It says as early as January, we might be able to make some changes.
Right.
So those are two separate programs. And I think it's you know, there has been no indication that vaccine requirements in workplaces or at universities will be changing in the near future.
Okay. Okay. And that actually gets us past 1 o'clock. Sorry for keeping you, doctor. Thank you so much for your patience and taking the time to answer all these questions. Thanks everybody who participated. Thank you for your live questions. That was a really great interactive session we had today. We will be back with the doctor next week. We'll be focusing on another theme next week, but as always, we will take all your COVID questions as well. For now, we'll say thank you and bye-bye. Thanks, doctor.
Bye.
Bye.